So one of the things that my patients often tell me that they avoid is watching TV at night or using any type of screens or screen time. And they kind of know, oh, I shouldn't use any light or have any light around because it will wake me up and it's going to cause my insomnia. But is this actually true? Is it actually true that if we watch TV at night, that's going to perpetuate our insomnia? So we should avoid all screen time at all for nighttime, especially for people who struggle with sleep. Hi, if you're new here, my name is Dr. Parky. I'm a Stanford-trained behavioral sleep medicine specialist, and I've treated hundreds of patients with chronic insomnia, typically successfully, and I'd love to share some of that information here with you. So despite all the hubbub about blue light and no light exposure at night, otherwise it's going to cause insomnia, the research on the effects of light on sleep is actually not very well substantiated. There's a lot of research that doesn't suggest that there's a strong link, and even the ones that do find an effect does not find a very powerful effect. Like one study found that it delayed sleep time by about 5 or 10 minutes. And the reason for this lack of a powerful effect is because the amount of light exposure we get from watching the TV or using our phone is relatively minimal. So the light exposure, otherwise known as lux, which is the unit for light, for screen time is usually somewhere between like 10 to 100, maybe even less if you're watching, your TV from pretty far away. Whereas the sort of relative light exposure from the sun as you're walking out during the day is like 100,000. So 10 to 100 compared to 100,000 is so minimal that our body and mind basically don't really register it very much. And when researchers do these type of studies, they're actually offering the patient some level of dark adaptation that happens first, meaning that throughout most of the day, the person is stuck in sort of a dark room, they're getting minimal light exposure before being blasted in the evening with, a powerful light source to see if there's an effect. So it's not even a very strong effect, even with these sort of precise controlled variables. And it's going to be even less if we're, going about our day getting light exposure from the sun. So overall, my perspective, in consideration of the research evidence as well as my own clinical expertise, is that light is not the devil that people make it out to be, and you don't have to be too worried about using your phone or watching TV at night, especially if you're somebody who gets, a reasonable amount of sunlight during the day. So don't worry too much about the light, but what I would consider you to worry a little bit about or be mindful of is the sort of content that you're consuming during that period. So you don't want to be watching a horror movie or scrolling on TikTok or Instagram and seeing feeds of like really scary things or things that would make you worry. If you are on TikTok or Instagram, maybe you go on dog talk or look at animals or fun things that allow you to get down into sort of a low arousal wind down period. So more the content than the actual light exposure. So if you're engaging in stimulus control or engaging in a wind down period before bed, totally cool to go on YouTube, totally cool to use your phone or watch the TV. Not going to be a big deal at all. Just again, be mindful of the content. If you're interested in learning more, feel free to continue looking around my channel because all of my videos are going to be for treatments of chronic insomnia without the use of medications. I'll also put a link in the description below for my book as well as a free guide/insomnia template that might help you to begin starting to treat your insomnia and going on your insomnia journey. Thanks for watching as always. Bye-bye.